Hi there, and welcome to another episode of African Business Stories. Africa is the only region in the world where more women than men choose to be entrepreneurs. What this says to me is that the story of business in Africa is the story of the African businesswoman. So we're on a journey of discovery to find these women and tell their stories. On the show, we will hear from female innovators and entrepreneurs building and running businesses in Africa. They will share the highs and lows of their entrepreneurial journey and lessons learned along the way. Some of these women you may know, and many you may not, but I assure you that all their stories are inspiring in their own right. My hope is that these stories will inspire you to reach for your dreams and leave a legacy for generations to come. It makes such a big difference to us if you can rate, review, and share our episodes. You can do this mainly on Apple Podcasts, and you can find us on all podcast platforms. If you're in Africa, Spotify is now available, so check us out there. And don't forget to rate, review, and share. On the show today, I chat with Lucy Msukwa, founder and executive director, Uchembere Wabwino Maternity in Malawi. Following the health challenges faced by her family members, Lucy decided on a career in healthcare from an early age. She started this business in September 2019, and we talked about how she spent 4 years saving to start and the challenges she faced as COVID hit in 2020. Her growth has been exceptional. She has gone from offering under 5 healthcare and maternity services only to offering outpatient services, laboratory services, maternal and childcare services, and even surgeries. She has grown her patients from 500 to well over 2,000, leveraging social media and technology. Lucy has invested a lot in her personal development, raised a significant amount of money through pitch competitions, and today is helping other business owners in Malawi start and grow their businesses. A country with one of the highest maternity and under 5 mortality rates in the world, Lucy is on a mission to bring those numbers down. Let's get into it. Hi, Lucy. Welcome to African Business Stories.
Thank you.
Thank you so much. You're my first guest from Malawi, so excited to have you on the show. Excited to learn about your business and a little bit about Malawi from our conversation today. So I read that you were born and raised in Blantyre. I don't know if I pronounced it well, which is like the largest city in Malawi.
Yes, I was born there and raised there in Blantyre.
So what was it like growing up in Malawi?
Growing up in Malawi, I was born in a family of 5 children. We are 2 girls and 3 boys. I'm a third born. So we grew up in Blantyre, all of us. The family, we were staying with our parents. And my education, I did it in a primary school. We call it Mlambalala, from standard 1 up to 8. So the environment is full of, I can say most of the population in Blantyre is full of people who are in their youthful age. And it's a city which has got a lot of industries that are currently happening in Malawi. I can call it, it has got a lot of industrial area with a good environment. Blantyre, sometimes it's very cold, sometimes it's very hot. So that's how I can put it in terms of weather. But the food is also very nice in Blantyre, and the prices for the food in Blantyre, when we compare them with other regions, the prices are a bit lower than in other regions. So yeah, I grew up with my brothers. My sister was going to a boarding school. So most of the times I was playing with my little brothers. That's what I can say about me growing up in Blantyre. Otherwise, it's a good city full of people moving up and down every day.
So there was an experience that happened when you were young that kind of shaped the direction that your life and your career took. Do you want to
Yes.
share that with us?
Yeah, I can share the experience because it's what motivates me up to now. When I was very young, I always wanted to do something concerning health because my mom was sick and my dad was also sick. So I remember one time when we went to the hospital with her, there was only one person who was taking care of 20 people. So during that time, my mom had a high blood glucose and she fainted. For me to go and call the other person who was working there, she was also very busy with other patients who were very critically ill. So she couldn't come and help us on time because her work was very overwhelming. So it was very bad, despite that my mom was okay eventually during that time. Then the passion for me to do something concerning health began to grow while I was young. I remember that time it was when I was in standard 5 or in grade 5. That's when the passion for me started growing into saying, no, if there were a lot of who were around taking care of patients, I think my mom could take time to be seen. So that's where the passion developed. So as I was going to school all the time, when teachers ask us, what do you want to be when you grow up? I would either say that I want to become a nurse or I want to become a doctor. Throughout of my life, I was always saying that. Yeah, so that's really what happened, like a motivation for me to do something concerning health.
Concerning health, yes. So you then went on to study nursing.
Yeah, actually, what happened was after my mom passed away, then my dad also was also sick. And during that time, my dad had tuberculosis, so I was also taking care of him as my sister was at boarding school. So it was like me who is only there who can take care of my dad. So I was going with him to the hospital. Still the same, I was seeing that there is still a gap in terms of human resource and technical staff in hospitals. So that was still bothering me to say, I think there are very few people who have done courses in medical health or nursing. So after I went to, after my dad also passed away, that was when I was in Form 3. Then I said, I think it's high time for me to continue working hard, and then I should do something which I want. So I went ahead and applied for the university entrance, and all the choices, we are given 3 choices to select the schools which we want to go. So the first choice I selected that I wanted to do nursing because I was looking at the points which I had 18 points. So it was like a challenge for me to have more chance if I go for a degree to become a doctor. It was a very big challenge for me. They would have not picked me because of the points which I had. So for me to increase my chances, I just applied for a nursing school. So my first choice was a nursing school and College of Medicine. So eventually they chose me to go to College of Nursing. So that's when I started the journey, focusing on my education and everything. So I remember I was talking to my friend. I said, you know what? I have a dream that I want to start operating a clinic. So she was laughing. She said, no, you are just joking. So I said, no, this is deep in my heart. One day I will open a clinic.
I'm sorry about the loss of your parents, and it's wonderful to see that motivated you to try and solve a big problem in your country. So when you finished at the College of Nursing, were there jobs readily available at the time?
Okay, actually, when we finished at the university, we were already given an opportunity to select three regions. It's either you want to go to the south or central or northern region. So because I wanted to get closer to other relatives, I had to select to be in the northern region. So I was selected to Northern Region Hospital where I was working. So yeah, we had that opportunity to select.
Is that Muzuzu? Is that how you moved to Muzuzu?
Yes.
Okay. And how long did you work at the hospital in Muzuzu?
So in Mzuzu, I worked there since 2014.
Okay.
2014 up to 2019.
I see. Okay. And then it was in 2019 you decided you wanted to start your own clinic.
I worked in Mzuzu Central Hospital for 4 years. During that 4 years, I made some connections with other people in healthcare profession. During that time, I was also coordinating online courses. So I had an opportunity to meet different people. Some were lecturers, some were professors. So they were the ones who guided me through to say, if you want to start opening a clinic, you need to have the following things. So I needed, during that time, I needed to strategize. That's what I did.
So how did you come up with the name Uchembere Wabwino? Did I say it properly?
At least you have tried. It's Uchembere Wabwino.
Uchembere Wabwino.
Yes, Uchembere Wabwino. So I came up with the name because in English it's called self-motherhood.
Okay.
Yeah, in English it's called self-motherhood. So in our local language, the one which we usually use is called Uchembere Wabwino.
Okay. Oh, that's nice.
Yeah, so I got the name after looking backwards, what I passed through with my mom. So I said this could be a good name for the clinic because I want people to have good, to promote self-motherhood. While they are pregnant or before pregnant, their health should be okay without having any complication. So that's where the name came from.
That's a lovely name. So how did you raise the funding to start, and what initial services were you offering when you first started?
All right. So when I started, for me to raise funds, as I said earlier on, I had to make some connections with other people who are also in healthcare. So I had to ask for some ideas. But then because they had told me that if you want to start operating this clinic, you need to serve government for 4 years. So as I said earlier on, that I had a dream since I was very young and I was growing with that dream. So once I just started my first year at the Mzuzu Central Hospital, I told myself that I need to strategize for me. If this dream has to come true, I need to strategize. So I had to start saving from my salary. I gave myself a task to say 20% of my salary is going to be going towards the dream that I have, that I want to open a clinic. So I was saving. Within 3 years, I opened an account, a fixed deposit account, whereby that money was going there. So I worked for 4 years while saving the 20% of my salary. And then after accumulating some resources, then I also applied for a bank loan, almost $1,000 as we are talking now. So that was how I started. I started with the savings, my own savings, and then plus a loan from the bank. So that's how I started. I just got a few things that were needed for me to start.
That's fantastic. So what services were you offering then? I know now you have a suite of things that you do, but when you started, what were the initial things that you were offering to women and children?
So during that time, we were only offering under 5 clinic and maternity services. That is all.
And I also know that you opened this business just round about COVID.
Yes, exactly.
Just in the middle of COVID. So what was that like for you?
It was very, very painful because I remember when I just started, we started in September 2019. That was already at the end of the year. So we started in September 2019, and then 2020 COVID came.
Yes.
I tell you, it was a very bad experience because medical resources had gone up, maybe times 10. The things that we were buying, maybe 1,000, they went to 9,000. I remember that time I had to cry. I had to cry, like literally crying, to say, why is this happening? I'm not going to manage. By then, to find money, to find resources to manage the clinic, it was very hard, despite that people were saying, no, this is your opportunity, now you can make money because there is COVID. But to me, it was opposite, because I'm just starting. I am not yet fully established, and then COVID-19 is coming, and then the prices for medication is high. Everything is high concerning resources for a clinic. So I remember I was telling, by the way, I'm married, I was telling my husband to say, I'm going to close this thing because it's not working. Like, it's not working. So I then sat down and said, I think I will give myself 3 months to wait to see if we are not making any money for us to buy resources or to pay salaries and rentals, then I'm quitting this thing. I think I will restart when I am ready. So surprisingly, during that 3 months, we managed to survive. We managed to survive. Everything was okay, and things were moving smoothly. Then I told my team to say, if we have managed to survive these 3 months of COVID, then we are going to survive in the next year. Let's continue the journey. So that was what happened. We really survived. Otherwise, when COVID came in, I was very frustrated and it was hurting. Yeah, it brought so many challenges to us.
That's incredible. And in reading your story, I know those were hard times and you pulled through. I read that you were able to increase your patients or your clients from like 500 to over 2,000, almost 3,000 by 2021 in a 2-year period. How were you able to do that?
But to do this is because we had to incorporate some marketing strategies. With this generation that we are coming, it's a generation that is more interested with technology. So I had to leverage on using social media by involving other people in the community, telling them about our services. So we were using social media adverts. Of course, in the healthy sector, you are not supposed to advertise about your services, but we are just using the social media, like, to inform them the services that we are doing. We're also doing free clinics. So with that, it made us to have like more customers. People were very interested to say, these people, they are everywhere. If you click on Facebook, we are there. If you click on our website, we are there. If you click on any social media, we are there. So that made us to be known across. So we leveraged more on using social media because, hospitals, they don't like to interact people on social media. They don't like interacting with other people. Maybe during the outreach, they just go there and give the service. But we made it to be more like a community-centered, so that people, when they are giving us for example, some advice, you say, we are taking the weaknesses from other clinics to say, other people are complaining that they don't receive this from the other clinic. How best can we do it in our facility that we should be having more customers? So we were working on the weaknesses of other, I can say, competitors, and then also leveraging on the social media marketing, because now new generation people just search online. So that's what we did. And like other people who are very old, maybe they are in 60s and they're operating, they don't even know about social media. So using a social media is the one thing that had made us to be known more and have increased in number of clients.
That's fantastic. So today, what services does your clinic offer?
So currently, we are offering outpatient medical services. We are also offering laboratory services. We are offering maternal and child health services. And now we have also started conducting surgery. So that's what we are doing now.
Oh, wow. In preparing for this interview, I was just reading about healthcare in Malawi,
Yeah.
and it was just shocking that apparently Malawi has one of the highest maternal mortality rates and also high under 5 mortality rate. So
Yes.
what is it actually like on the ground?
So on the ground in Malawi, we don't have adequate facilities with good resources.
Okay.
So the health centers, I would say health clinics, they are very far for people to reach. And we only have like 3 main central hospitals that we depend on across Malawi in each region. But then to find a good hospital which is fully fledged with everything, every resource that could help a person or a woman, it's very tough. You would find a hospital, they don't have any medicine, they don't have any machine, but yet it's a hospital. So that's why we are still having a problem in these maternal deaths. And women, they travel 10 kilometers to go to a hospital to access care. So some, they just opt staying home to just deliver at home. And some, they just opt to go to traditional birth attendants in their communities. So this brings in more complications, and eventually people they end up dying, which causes high maternal mortality rates.
In terms of cost, what does it cost, to come to you as opposed to going to, I mean, it's not like there are many hospitals to go to, so, people don't really have a choice, but is this a costly service for the people in Muzuzu?
What we did was we made the clinic to be a hybrid, like a for-profit and non-profit. The for-profit side, we use it to run for the other like buying medicine, salaries, and everything. And also the profit made from the for-profit is used to the non-profit side, whereby we go to communities in Zimba district, whereby we go and offer the services for free. So when we were coming up with our pricing, we had to do a research to say how many clinics do we have in Mzuzu and what are the prices that they are offering. And then we had to come with an average to say we shouldn't be competitive, but we should provide an affordable price that somebody who is staying within our catchment area should be able to pay for the service if they are sick. So that's what we did. And then if we compare with other among us we are a bit affordable because we had to look for those people with this lower socioeconomic status, because our clinic is closer to those people who are very in a group of low socioeconomic status to the market and sell tomatoes, and they come back, they sell vegetables. So we had to put our pricing so that those people we are targeting, they should be able to pay for the service, and then we should survive. So our price is affordable for an average person who is maybe doing a small business, and they can be able to pay.
That's fantastic. That's fantastic. Thank you for the work that you do. So in terms of business development, we've talked about how you've used social media to grow your client base. And then in terms of funding, I know that when you started, you said you used some of your resources and also took a loan. I know that you've had access to grants.
Yes.
Can you talk to us a bit about how you came to get some of these grants?
All right, thank you. After 2020, COVID came. Then I saw that there was a certain opportunity. I was saying I am a healthcare person, but I still lacked knowledge concerning business. So
Yeah.
I was asking myself to say, how do I fill this gap that I have? I can provide good quality care to a client or a patient, but then in terms of business, I don't have any information concerning business. What should I do? That's when I started searching online to say which people train people into entrepreneurship, what organization train people in entrepreneurship. So my journey started when I enrolled for Academy for Women Entrepreneurs, AWE, by United States of America. I said, okay, I'm going to apply for this opportunity. They are saying they train females in business, how to run their business. Me, this information I don't have. All I know it's about giving patients medication or taking care of them. So I said, let me give it a try because I have a gap in this thing. So when I did that, it was a 6 weeks training. We did it online. It was very interesting to learn the concepts. And surprisingly, during that time, it was the first cohort in Malawi to be piloted. Surprisingly, I was only the person who was in healthy sector. We were 90 females. Only myself, I was in healthy sector. I was like 89 in agriculture. There was a very big competition. So even when they were giving examples where we were learning, I was like, how am I going to apply? They are talking about Coca-Cola. They are talking about Uber. What am I going to do with this information? Me, I'm dealing with people. So it took me some time to say, I think I can really apply this information that they are teaching me. When they are giving the examples, I would still try to use it to my business, to connect to my business, because it's a service provision, and they are talking about Quora, they are talking about Uber, they are talking about Apple. I was like, okay, I'll still remain in this cohort. Let me give it my best. So I was using the knowledge, and then eventually after the 6 weeks training, they said you are going to pitch. It was my first time to hear the word pitch. Okay, so I said, I'm going to pitch. So we pitched, and unfortunately during that time, it was for a legion. So they had selected someone who was agriculture. As I said earlier on, that even the judges couldn't understand my business because I'm in a healthy sector. So I said, okay, fine, no problem, so long as I had information concerning entrepreneurship. So at the end of our journey of the course, they said, no, we are going to give you an opportunity again for you to write a proposal where you can receive funding of 10,000. I said, okay, I have a strength in writing things. So I said, let me use my strength in writing the proposal because this is my strength. We wrote the proposal. We forgot about it. Months in 2021, I just received an email to say you are one of the awardees for the what? For the United States African Development Foundation grant. I was like, what? I was very happy. Out of the 90 fellows, we were only 6 who were selected in Malawi.
Fantastic.
So that was the beginning. Yes, that was the beginning of us to start growing because we implemented the project very well. So, when you implement the project very well, other donors, they are also interested in coming in. So whenever there was an opportunity for entrepreneurship, I started telling myself to say, if I have made it this time, I think the next time if there is another opportunity, I'm also going to give it a chance. So I have this passion of always wanting to learn more and more and more. So after that opportunity came, we do the project. Opportunity had come with the social incubator Malawi, Sigo Family Foundation. I said, I'm going to give it a try again. I gave it a try. We went for an 8 months incubation. So during that time, I was using the information that I got from Academy for Women and to transfer it to Social Impact Incubator. They also gave us another information that was very beautiful, very relevant. I learned a lot of things. I started applying them. And then we were also given opportunity. Actually, when we were applying for Social Incubator, there were 211 organizations. Out
Wow.
of the 211, they only wanted 10.
Hmm.
So we were among them. So we went for the incubation
Fantastic.
program, and then we were also given an opportunity to do a pitch. So I had to work on the pitch, and fortunate enough, I was on the first position. So I was
Wow.
given a grant of $15,000.
How much?
15,000.
Who was running your business in the 8 months? Because that's a challenge sometimes. There are entrepreneurs who want to go away and do some of these programs, but wonder what will happen to their business. So how was your business running those 8 months, or did you shut it down? What did you do?
No, I did not shut it down, but I
Hmm.
have a team. You
Okay.
know, most of the times, of course, when we are the founders of an organization, we are afraid, we have this fear that this organization is going to fail. But if you have trained your team very well, they always
Hmm.
managed it. Despite that you are not there, you are not available, but they will always manage it. So
That's
it goes
fantastic.
with the good team. If you have a
Hmm.
good team, everything is possible. No need
Hmm.
for you to worry to say, I think the organization is going to go down. So I have a good team, which I selected. We always take them on board and explain everything. And we usually look for people who have got the same vision as we have to say you
Hmm.
should incorporate your values with that of the organizations. They should be in
Yeah.
line. If they are different in with the organization's values, then that person, we don't select them because we know that they won't be part of us. So that's what
Hmm.
I did. Yeah.
The various grants that you've been able to raise, how have they been deployed in the business so far?
To be honest, the grants that we have been receiving, they have pushed us very much. And sometimes people, they
Hmm.
do wonder to say, in just 3 years, you have done a lot of things like this. So it's because of the grants that we have been receiving, and we implement what we have said we are going to implement with the donors. Because most of the entrepreneurs,
Hmm.
what they like, they make a mistake when they don't implement what they had agreed. So we usually,
Hmm.
like the first grant, we used it for the theater equipment. The second grant, we used it for the laboratory. So we make sure that when we're asking for the money, we should really use the money for the
Yeah.
intended purposes. So that's what we do.
You're also a Mandela Washington Fellow.
Yes, I'm a Mandela Washington Fellow.
How did that come about?
Um, It was my first time applying for Mandela Washington Fellow. I was just hearing people saying, no, Mandela Washington Fellowship is a very good fellowship. They do this and that. So I was interested. I was like, okay, I think if I have been able to move this direction, I still also have a chance to participate in this fellowship. So let me try it before I reach, my age reaches 35 years old. So I applied.
Yeah.
And fortunate enough, I was selected. When I was selected, we went to
Hmm.
do the fellowship. And luckily enough, when we went to the university that I was selected to go, Iowa, they have also this component for entrepreneurship. So I said, okay, we are
Wow.
here. Let us utilize this incubation process. So they trained
Hmm.
us, they gave us certificates, and upon completion for our fellowship, we were also given an opportunity to pitch our ideas because they were training us into becoming someone in business, like how the US is
Yeah.
doing, how in Africa we are doing. So they said at the end of the course, they said, we are going to give you an opportunity to pitch. Of course, we were 20 fellows from different countries. So we had a
Hmm.
competition, and very fortunate enough, I was also selected to be number one. So I received $8,000,
Wow.
yeah, for my pitch. So they even took my pitch decks. They used them for training their students up to now.
And so I see you've invested so much in your personal development
Yeah.
and also in growing your business and attracting funding. So, Lucy, earlier you spoke about supporting other female entrepreneurs in Malawi. How exactly do you do that?
All right, thank you so much, Akego, for that question. The way I support other women in Malawi is because I do volunteer myself with other entrepreneurship hubs. So through those entrepreneurship hubs,
Okay.
they select some women who are doing businesses. So I act as their mentor. So, like since in 2023, I
Okay.
have managed to mentor 120 women. What I do is I help them to
Wow.
like how best they can go about their businesses. We start from scratch. Maybe a woman even has got an idea. I help them to how best they can register their business, or how best they can first do the market research about their business if it's at an idea stage, so that they should be able to know whether the business is going to make profit or not. So far, I have managed to mentor 120 women through mentorship in entrepreneurship. I do have some experience in leadership and management training, including how to pitch. So I use my skills to train those women. So since I'm an alumni for
That's
Mandela Washington Fellow, we are given an opportunity for a space where I'm based. So whenever I have meetings with those women, usually I take a cohort of 30 women. So we meet maybe once in a
hmm,
month, and then I train them on maybe how to search for grants or how to pitch, how to come up with a business plan. So it's not
okay.
only the women that I help, even men, youth who are aspiring to be entrepreneurs. If they reach out to me, I also help them in terms of giving them the knowledge and expertise on how best they can start their startup, or how they can grow their business, or I give them some resources or where to find some grants if it's a non-profit organization. So that's what I do.
So, Lucy, in terms of growth, do you have any expansion plans in Muzuzu or in Malawi as a whole?
Initially, I had plans to expand across Malawi, like to have the organization in all three regions. This year, I sat
Okay.
down and I was reflecting, and I was saying that majority of the people who need the services are those who are from rural areas compared to those who are in urban areas. So I have changed track. The way I'm going to
Okay.
scale this organization is I'm going to go in hard to reach areas in the rural settings of Umzuzu. So I'm going to open like sub branches in the rural settings of Umzuzu, because
Okay.
I see there is a huge gap compared to those who are
Hmm.
compared to the other regions, because in the regions we usually have got big hospitals. So I want to cover the gap in the
Right.
rural areas, whereby there, of course, hospitals, they are there, but they don't have enough resource and equipment. So I want to go in those
Hmm.
areas and maybe have four more clinics in the rural areas, in different areas, and then put all the necessary equipment so that those people should be able to have access to the care that they can be looking for in an urban area. So that's what I'm going to do. And in terms of pricing, it's not that it's going to be standardized. It's not going to be like the way we charge in urban area. It will be a subsidized rate, so that
Okay.
those people in the rural area should be able to pay for the service, as well as they should be able to have access to those services. So that's my plan in terms of scaling up this organization.
Fantastic. And all wish you all the
Thank
best with
you.
that. As we wrap up, I normally ask my guests two
Yes.
questions. One is a reflection, and the other one is
Mm.
advice. So, in terms of reflecting, what would you say has been the most impactful thing for you that you've achieved in building this business in Malawi?
So one of the most impactful thing that I feel like I have achieved in Malawi is starting the organization itself as a young woman. It's a big achievement, because in Malawi, I don't know in other countries, most of the people, they have got a mindset to say it's only those people who have retired, they are the ones who can open hospitals. So I took a challenge to resign from my normal job in a government sector and started this organization. And in only three years, we managed to grow to have everything. So I feel that this is very impactful, being a young woman and running this organization with 20 employees. So I feel pride in myself in what I have achieved so far. Yeah.
Yes, congratulations on that, Lucy.
Thank
Big
you. Thank
congrats. What advice would you give to other women who are building businesses in Africa?
Thank you, Akayego. The advice that I can give to other women who are doing business in Africa is to be resilient. In business, it's not
Hmm.
always that you are going to have money. Sometimes there are tough situations that you have to overcome. So they need to be resilient and to be able to make plans and goals so that their businesses should always continue growing. And we need to dream big like men. We need to dream big. In business, there is no a simple path. It's always you have to struggle and then things work out. That's the advice I can give to my fellow women.
Thank you so much. Thank you, Lucy. This has been a great interview. Thank you.
You're welcome, Akayego.
Thank you so much for listening. If you're not already subscribed, please do so on Apple, Spotify, or wherever you get your podcast. And don't forget to leave us a review so we know how we're doing. I'm Akego Okoye, and you have been listening to African Business Stories.